Hello, I'm Dr. Sudharkmurthy. In this video, I'll discuss regarding guidelines and advisory issued by various regulatory bodies to dental professionals working in UK, as well as a must-read for LDS and ORE examination. In UK, it's essential that we follow evidence-based practice. An expert panel, after thorough deliberations, issue these guidelines. It can be advice, guidance, or even good practitioner's guide. They are updated regularly, and it's the duty of dental professionals to inform themselves regarding the latest updates and incorporate them into their practice. Let's now talk about British Dental Association, or BDA. This is a professional body and it advises its members and public regarding various things like practice, management, and opportunities for CPD. They also publish a journal called British Dental Journal, and they have various useful articles for you to read. They also have expert advice sheets known as BDA sheets on various topics like complaint handling, safeguarding adults and children, consent, risk assessment, radiation protection, and there are quite a few. It's useful to skim through all of them and read them up. They're quite important from the examination point of view. Let's now come to guidelines. Let's talk about RCS guidelines. If you go to RCS website and search for clinical guidelines, there are a number of them. Each one of them is really very important. You need to read all of them. Let's talk about the TMPDS and orofacial pain guideline. TMPDS is a very common question in your Part 2 examination, very important. Now, TMPDS is a common and complex problem, and we see a number of patients in general dental practice as well as secondary care. The GDPs generally struggle to manage this because of the complex etiology, and then they refer them to secondary care where it's much more effectively managed. However, the guideline very clearly explains the holistic management of the complex etiology. It discusses about the local factors, the systemic factors, as well as the psychological aspect, the added element of stress. And they also discuss about, different things like alternative therapies like physiotherapy, cognitive behavior therapy, etc. Pharmacological aspect, non-invasive and invasive ways of treating this problem. They discuss about counseling as well as, rehabilitation. Very comprehensive guidance. Very useful for primary dental care, the general dental practitioners, and so that they are able to manage this in the primary care rather than referring it to secondary care. Additionally, there is a flow chart and a table towards the end of the guidance, which discusses about the detailed case history taking for pain, orofacial pain history, and also they discuss the signs and symptoms in depth. Very important for your Part 2 examination, the case history taking. Very useful guidance to read. Let's now move on to Scottish guidelines, SDCP, Scottish Dental Clinical Effectiveness Program. There are a number of guidelines and very important for your examination. These are Scottish guidelines, but we follow them in UK. The first one is drug prescribing. The first chapter in it is medical management of emergencies. What I suggest is that first you go to resus guidelines and read up the assessment part of the emergencies. It's discussed there. The airway, breathing, circulation, disability, exposure, all this is discussed in depth. Now the medical management part of the emergencies is moved to BNF. So you need to go to BNF to read up that one, and then return back to the first chapter in the drug prescribing. So if you read this much, it's more than sufficient to prepare for your medical emergencies. Also, there is an app, connecting the SDCP to BNF and BNFC. Very useful for prescription. You will be asked to prescribe drugs in your Part 2 examination. Very useful. So the next guideline, SDCP guideline is important one is anticoagulant and antiplatelet. So there are a couple of tables summarizing all the drugs, the warfarin, the newer novel oral anticoagulant drugs. Very useful, and you need to not only read them, but it should be at your fingertips. There are also guidelines on bisphosphonate as well as oral health management of medical related osteonecrosis of the jaw. Again, there are a couple of tables regarding the drugs and the management aspect of this. Very useful, you know, you've got the summary there. It should be at your fingertips too, very important. There is an update on amalgam on STCP, you need to read that. And there is one on conscious sedation. So the conscious sedation, it discusses about the safe and effective provision of conscious sedation, the types of IV, you know, types of sedation, IV sedation, inhalation sedation. They discuss about the consent and pre and post sedation instructions for the patients undergoing dental procedures. Very important, because you will be given IV sedation unit and asked to label all the parts as well as the safety features. This is a written OSCE for your part 2 exam, as well as you will get actor OSCEs for pre and post sedation instructions for patients undergoing dental procedures. Quite a common question, important for you to read. The next one is emergency dental care. There is a guideline on that, and there is a flow chart, and it's very useful. It tells you how to manage all the dental emergencies and the number of questions asked on this, and also useful for you when you work you know, in practice or in emergency. There's a guideline for caries in children, and number of questions are asked on this as well, so you need to read that out. Next, going to delivering better oral health. This is by Department of Public Health, very comprehensive, and they focus on the preventive aspect of oral and general health. So it's a periodontal toolkit focusing on the preventive aspect, preventive approach in practice. So what oral health, what they are discussing here about the teeth, the different types of toothbrushes used, brushing techniques, you know, the toothpastes and the amount of the toothpaste used for different ages, as well as fluoride content of the toothpastes, fluoride content of fluoride varnishes, and mouth rinses. All the preventive aspects, you know, to prevent dental caries. They also go to discuss about the gum health, you know, and the dietary advice to prevent caries, as well as diet dairy. So diet dairy is very important. You get this in your part 2 examination. They also discuss about the healthy portions, healthy food, healthy portions to eat, and then predisposing factors for oral cancer, risk factors like smoking, alcohol misuse, and anti-smoking advice. They also discuss about cancer awareness, prevention awareness. You get number of questions on this, so quite important. The next one is NICE guidelines. So NICE guidelines is National Institute of Clinical Excellence. It's an independent organization, and they are providing national guidance on promotion of good health, and they focus on improving the clinical standards of patient care and safety. There are a number of guidelines, one on wisdom tooth removal, another on dental recall intervals, oral cancer referral, and there is an updated one on prophylaxis against infective endocarditis. So you read them up. Quite important. Then we got another document which is from the British Society of Periodontology, and this is called Good Practitioner's Guide. So a comprehensive document all about periodontal diseases. You know, you can just read this. You don't need any textbook at all. Everything is here. Very good illustrations, you know, beautiful. Want to read. So they discuss about all the periodontal diseases. They discuss about the risk factor, local and systemic risk factors for periodontal diseases. They discuss about perio screening, as well as detailed charting, 6 PPE, different types of radiographs used for periodontal diseases, and most importantly, they discuss about the new classification system. You know, you'll have number of questions on this. in your upcoming examinations. So very important for you to read. They also discuss about implants. Everything's there here, very clearly explained. Lovely document. Next is cross-infection control and health and safety. There's a document called HTM 0105, Health Technical Memoranda 0105. It's comprehensive guidance on decontamination, sterilization, disinfection, types of disinfectants used to clean the tabletops, various surfaces, different kinds of sterilizers, autoclaves, wrapped and non-wrapped instruments, what instruments you wrap, how do you store them, how long, where do you store them, clean area, contaminated area. They even discuss about your layout of your clinic, and airflow from the clean area to contaminated area, contaminated to clean area. They discuss about how to clean the instruments, as well as washer, disinfector, waste disposal system, single use, and and then PPE, hand hygiene, infection protocols, various, they also discuss about how to contain the Legionella infection, as well as, sterilizers, how to maintain validation, maintenance, infection control policies, procedures. Very comprehensive. A number of questions are asked on this. Very important. You need to read it up. So, duty of candor. So, as a part of good clinical practice, statutory duty of candor document has been published. This discusses all about the iatrogenic injuries to the patient cost, and the near misses, the diagnostic misses. They ask you to candidly explain to the patient where the mistake happened, how it happened, what steps could have been taken to prevent it, as well as how to rectify it. Number of OSCEs are set on this. Very, very important from the exam point of view. So next, moving on to COVID guidelines. So following the recent crisis, number of guidelines have been issued on, number of guidelines and advisories have been issued, and it's relevant for the upcoming examinations. So you need to keep yourself updated regarding this. Very important. So have I missed anything? Just have a look. So finally, I would like to suggest isoform course. It's an online course, and it's just for £36 for subscription for 1 year. They have courses on number of topics like emergencies, infection control, law and ethics, safeguarding, and your subject topics as well. So many courses, and it's for a year, and it's quite cheap. You will get CPDs as well. Very, very good for your examination, since you have updated information and guidelines, as well as there are questionnaire at the end of each course. Very useful for you. So I hope you liked my video. Thank you very much for watching. Kindly share and subscribe my videos, as well as comment on the section below. Let me know if you want me to make any videos on any particular topic. I'll be quite happy to do so. Also, if you give me a thumbs up, that gives me a validation, and if you have liked my videos, it's very useful. Thank you very much for watching, and I look forward to see you in my next video.